Welcome to the Green Wisdom Health Podcast with Dr. Stephen and Janet Lewis, where you will learn about natural solutions to common ailments. And now, here are your hosts, Dr. Stephen and Janet Lewis.
Hello and welcome to this week's edition of the Green Wisdom Health Show. I'm Janet Lewis.
And I'm Dr. Lewis.
And today we are discussing some differences between coronavirus, flu, and cold. So the name of this show is called, is it COVID flu or allergies? Because they all seem to be kind of hand in hand here lately. We don't know the difference, and frankly, we're going to help you sort out what to do about it when your immune system signs that could be low, and how to know what the difference is. And also your questions that you're so kind to write in on Shooting Straight with Dr. Lewis on his Facebook page, as well as on our greenwisdomhealth.com website. We will be answering a lot of those also. So hang on to your seats. We got a whole lot to cover, and when you get done, hopefully we can keep you from getting any of these things. So Dr. Lewis, how would you like to start out today? You want to go over what the differences are with the coronavirus, flu, cold, or allergies, or have you got something else?
Well, I'd like to call for sneeze, but I'm afraid to because you're afraid somebody's going to burn you at the stake. I'm just appalled at how much fear has taken place, and people have subjected themselves to fear that's created in their own mind. There is some reason to have some wisdom and be cautious, however, but fear, no, ain't got time for that. It's either upstream or downstream. Go downstream where it's easy and fun. We can talk about, if you have a chest infection or a cough, that's kind of common with a cold. It's pretty common with the flu, but with allergies, it's pretty rare. COVID can fit in all of that, and there's plenty of research that I'll try not to get into too much, but there's people that think it's totally man-made, and I'm not saying that's my opinion, but there are doctors that seem to be much more intelligent in that particular area that think it's very, very man-made. So, fever, you usually don't get a fever with a cold, but you can. It's usually pretty high with the flu, but not almost never present with allergies. So there are some differences, and I think we all get them confused and all have a tendency to self-diagnosis. That's a fallacy at best.
Well, I'm hoping maybe you can streamline, in general, are there different products that you can take that would kind of cover all of this, or do you need different products based on the different problem you're having, or can we narrow it down so that we don't have like a whole cabinet full of things and we don't know what to take when it's time to take it?
Yeah, I can do that. And of course, we don't make any claims about it preventing, anything or curing anything, but there are things, supplements that are very, very well known in the medical field to enhance your body's immune system. And so within those parameters, we will speak about that. There's a lot of things. You want to talk about the specifics?
Well,
I'll do that.
Well, I just know there's a lot of people that come in here, they call, and they're like, I think I have this. I don't know if I have this. I don't know if I was taking that. I haven't heard about this product. And do you kind of just have a little arsenal of things that help keep you healthy? Because, a lot of times people don't even realize that they're about to get sick. There's some common signs that you may not have a great immune system to start with. Maybe that's where we should start.
That's really good, and then I'll take up with, what to take.
Okay. Like maybe you're one of those people that seem to get more infections than other people do. That's a sign that your immune system isn't up to par. Your lymph nodes remain swollen. Because that's an excess of immune cells they're trying to accumulate. They're trying to work to fight off an infection. So if you seem to have that and you're affected by a head cold or sinus infection, sometimes the lymph nodes are in the armpits and groin. You'll see those swollen as well. You can tell that maybe you've got some kind of compromised immune system. So when these other things come along, you're just kind of a sitting duck waiting for it to, so to speak, jump on you, right?
Yeah, something like that. Your body does have several different types of immune systems, and it's pretty easy. And I'll go over the things that would help boost the immune system. One of the things that, and again, we can't make claims about this can't prevent a disease or, alleviate. It's crazy the way we have to dance around the truth, but still, we have to. And there's plenty of medical personnel, which I have the greatest respect for them because they've saved my bacon more than once. But there's some of them that noticed that COVID-19, when they see them in ICU, that first of all, they generally see them in the emergency room with a cough and fever, but not really enough symptoms to admit them to the hospital to meet the criteria that they go through. And that's why I have the greatest respect, because they have the MDs and DOs and nurse practitioners have so many rules and regulations. They're too busy doing all that. Then they could, I think, would be better served to spend all their time with the patient, but they're not allowed to. So if they don't have that criteria, they'd send the patients home. But then they'd notice that the patient would kind of come back a week or two later, very, very sick, needing oxygen. Some of the patients would end up being ventilated. And one of the best things you can do for your immune system is sleep. Now, I know sleep is very elusive for many people. We talked about high levels of vitamin D can get you in that deep restorative sleep. There's other things. We have some things I take. I take a CBD with melatonin, and you got to watch your CBD out there. That's a common question. Well, what do you recommend? I know you don't sell it. No, there's too much idiocy going on with the sales of it. But most of the CBD on the market is hexane extracted. That is not good stuff. Now, it needs to be CO2 extracted. Well, Dr. Lewis, how do I know which one? Well, buy it from somebody reputable. Now, if they walk in here, I'll sell it to them, but I won't sell it over the internet. A bunch of stupid rules. But the CBD I do with melatonin, I do 3 other melatonin, and I do a 5-HTP, and I'm apparently going to have to do some magnesium glycinate because I woke up this morning cramping like crazy, crying. It hurt so bad, and Janet was over trying to rescue me with some magnesium cream. Thank God. And I love it when she rubs my legs, so maybe I'll just fake it from now on.
I thought you were just faking it, so I rub your legs. So,
but deep restorative sleep, and I noticed I am sleeping much, much better because I'm taking massive doses of vitamin D. Now, you should not do that without seeing it on lab. And Brandy, I was just discussing some of these new labs we're doing with the intestinal permeability and the food sensitivities. There's specific criteria that if you have it, you have an extremely hard time absorbing vitamin D. So it's more than just taking it, and there's plenty of it out there that's not working, which is another question that came up. But the best thing you can do, or one of the major things to support immune system function, is sleep and then get outside into nature. And Janet and I just did a major, holy jeez, I don't know what in the heck my honey was thinking, but she said, God told me it's time to move. It's like, oh jeez, I'm sorry, I'm too old for this. But I did it anyway. But it's a wonderful community around a relatively small lake, and people, they go on golf carts. I'm going to get a Honda and go, but most people walk. So they're getting out in nature. I'm getting my fish feeder screwed down into the dock tonight. So get out in nature. So you sleep, you get out in nature, and then some of the other things you can do, quit worrying, quit being stress-filled, and that's something you have to fill your mind and your spirit with every day. Janet and I do both of those all the time. But if you want to talk about supplements, the vitamin D is incredible. Again, don't take a pot load of it, especially if it's over-the-counter crap. But don't take a lot of it unless you're getting it tested. Vitamin C. Now, we have the multi-element buffered C, which is really good. I'll tell you why in a minute. Then there's N-acetylcysteine. NAC, we call it NAC, quercetin or quercetin, and zinc. So even after getting plenty of sleep, going outside, getting in nature, and you can do things like take an alternating hot and cold shower every day, because that'll speed your nervous system up, your bloodstream up. I'm not so much on the cold shower thing, but we do a lot of the supplements, and I'll tell you why. Vitamin D, it's kind of hard to explain because the actions of it are incredibly diverse. It's a fat-soluble hormone, actually. It's not even a vitamin, but it's able to pass into the cells directly and affects the transcription of the DNA itself. That's a big deal, folks. Supports production of the antimicrobial peptides in the respiratory epithelium and promotes healthy inflammatory response. So inflammation is not bad. It just has to be at the appropriate time and not over-inflammatory. There was a study that was done, the Irish longitudinal study of aging, showed that vitamin D supplementation could support the upper respiratory system. And speaking of Irish, I thought the Irish flu shot was a shot of Jameson whiskey, but apparently I was wrong.
I think it has to have coffee with it too as well, right?
I've tried it once or twice. Sorry. I get down the rabbit trail of whiskey.
You talk about vitamin D a lot. One of the other ones that we have that is very overlooked is micellized vitamin A.
Yeah.
And, I don't know why A doesn't really get brought up very much, but...
because I don't take it until Janet sticks it under my tongue. So I'm not responsible for it, so it's not on the tip of my mind, I think.
But vitamin A is something whenever we feel like we have been too stressed or we feel like we're just really not going to make it, we'll take a little bit of this, and it's like, man, instantly perks you up. And it's important for vision and immune system function. It's for bone and cartilage development.
And people wonder if these supplements work, and it's like, well, I'm pretty close to 66. I feel 35 or so. And my optometrist is just halfway agitated because he says, you've got baby cataracts, and everybody else your age is getting your cataract surgery. And it's like, well, talk to me in 20 years. We'll talk.
Yeah, how do you know something you can't see because you've never had it, but you can see by people around you that aren't doing so well?
That's the rub. People judge this a lot. I said, well, I don't feel any better. And I said, well, I just spent $108 changing the oil in my truck. It didn't ride better and didn't get better gas mileage. So why am I changing the oil for $108?
Yeah, but vitamin A is also a very powerful antioxidant.
Big time.
And it helps protect your cells all over your body. And it helps with oxidation due to stress, environmental pollutants, and a whole lot more. The difference with our vitamin A is it's a fat-soluble nutrient, meaning it requires fat to be absorbed and stored in the body. Compared with many ordinary vitamin A supplements and vitamin A containing multivitamins, micellized vitamin A suspends vitamin A in an extremely small water-soluble droplet called micelles. That's why it's called micellized. These micelles are a special type of bubble with a fat-loving inside and a water-loving outside. And in these micellized packages, vitamin A is easily absorbed from the digestive tract. So if you don't get it in correctly, it doesn't do as good as it could, I guess, in some other forms.
And we have impaired digestion and assimilation anyway.
Yeah, super great for your eyes, though, so you don't have to eat so many carrots. And it does not turn you orange. So that's one of the things I wanted to mention. One of the other symptoms that you can tell of whether or not your immune system is weak is whether you're slow to heal. And people go, well, I don't know if I'm slow to heal. Well, because
that's what's real for them or normal for them, but normal for them is not necessarily normal.
And when you cut yourself, does it take the cut a lot of time to heal? People that are diabetics, it does them because they don't have the ability to heal back fast.
And sugar's one of the worst things you can do for your immune system.
And I remember before we started nutrition, it was like I'd get a cut and it'd take it months to heal. And I had no idea it was because I wasn't healthy. I was young, and I guess I just wasn't healthy. But now I can cut myself, and it's like a few days later, it's gone. So that's one way to judge externally whether or not you're getting enough nutrition in the body, of whether you heal quickly and whether you're sitting on the edge of something bigger getting ready to break down.
And C creates collagen, ladies, which means the more you put in, the fewer wrinkles you'll develop.
Oh, and I take collagen too, so that probably has a whole lot to do with it.
That's why she's whatever age she is and looks about 20 years younger.
I'm 29.
There you go.
Actually, anemia develops when a person has insufficient red blood cells. Some people with weakened immune systems develop autoimmune hemolytic anemia, where their bodies produce autoantibodies that attack red blood cells. I'm sorry.
Yeah, and there's I think 400-something types of anemia. Which ones are you? And don't try to figure it out yourself. Geez, I'm only good at 4 of them, but that covers a high 90-something%. Speaking of autoimmune, Janet, almost always low DHEA. So your adrenals are shot. They're not putting out DHEA. DHEA is the anabolic or building hormone. I love talking to people over their lab about that one. It's like, well, get it up on the high level of a 30-year-old, and you'll start acting and feeling like a 30-year-old because it repairs your brain and repairs your body.
And that's not something you hear a lot of doctors talk about when you go, how's your DHEA level? I think that's because there's really not a drug for DHEA. It's, it's something that people don't even know really what it is. But
people won't even take it for the right reason. Men, it's the precursor to testosterone. That's the only reason a man would take it.
But for goodness sake, you tell a man that, and you tell him to take 25 milligrams, and every one of them is going to take 75 to 100.
And that's too much.
That's right. You can't overdo it. It can become toxic.
There is the possibility of too much of a good thing.
Correct. So any kind of anemia. So if you got an iron deficiency anemia, even that, your immune system's impaired. So
and iron is increased in its uptake just if you put vitamin C in there. That's not the only cofactor, but it's a very important one.
So maybe just doing that will help them fight off illness and help, because anybody that's anemic is also persistently tired and fatigued.
It's usually a B6, B12 problem and a folate problem, the 5-MTHF, for those that know about that. Well, guess what? If you have that 5-MTHF reductase genetic SNP, we got you covered because we have the good stuff in all of our vitamins.
Digestive issues can also be a immune system decreaser, like inflammatory bowel disease, and symptoms such as reoccurring diarrhea can indicate a weak immune system. We always talk about, trains not moving through fast enough, like you're not going, but there are people that actually go too much.
Yeah, because, if the train's going too fast, it can't make the curve.
And then they don't get all the nutrition out of whatever it was they should have had because it didn't stay in there long enough, correct?
Good point.
Yep. So then their immune systems become lower and they're more apt to get problems down the road. So we tell people, make sure you're doing digestive enzymes. Help slow those trains down, repair that gut so that things stay in there longer. We have a joke. It's like, well, how long did it take before you saw the corn? It's like
it's a good marker.
That's the only way we eat corn. It's like, well,
that or okra seeds. Us in the South, we have to have our okra. Did I mention NAC, N-acetylcysteine? Well, it replenishes or helps your body produce glutathione, and that's one of the best detoxification things you can have. So NAC is really, really good. I want to talk just a little bit about zinc. Everybody says zinc, and most people are taking zinc that's not going to be absorbed no matter what. But zinc in its good form, which is, of course, all we carry, you have to have a zinc ionophore. And turns out quercetin is one of them, and so we do that. And I was treating this guy that has a massive worldwide podcast, and he called me when this COVID came up, and he says, well, I'm reading about zinc and quercetin, and you had me on it before COVID became a thing. I said, I know. Pay attention, folks. We put a lot into this. We work really, really hard so we can play harder.
Well, and I want to make sure I ask some of these questions that some of our listeners had here, and then we'll get back to some of this list and trying to help you decide whether or not your immune system's low and hopefully you're not going into COVID, flu, or allergies, but knowing the difference. This one especially caught our attention because we all had a discussion about it when it came in today. So, Rick, we're going to address your question. He goes to one chiropractor for his adjustments, and his wife goes to another. And the common theme is they both sell supplements from a company called Nutritional Frontiers, being that it seems to be a common brand in chiropractors' offices, which I've never heard of till today, but I guess it is there wherever you are. Maybe you could explain the differences between your stuff and theirs. I don't plan on switching by any means. I know that your products are top quality. Just figured it'd be interesting to some people since a common theme in our podcast is the quality of our supplements versus others. So that was a great question. We all had a little bit different answer on it, and interestingly enough, chiropractors get a lot of nutritional hours, I guess, educational hours. And so they're a little bit more knowledgeable about good products. I can tell you when Dr. Lewis first started doing nutrition, which he did more chiropractic at the time, he really wasn't so focused on nutrition, and he didn't do blood work.
But I did more nutrition than the average chiropractor back then, but I've grown leaps and bounds since then.
He would go to a lot of seminars, and the people that put on the seminars would be from some of those companies that would tell about their brand of product, and then therefore the chiropractor would start selling them because they learned at the seminar that it might help this, that, or this. When we started doing lab work and we started using some of those same products that were better than most, something better than you'd find at a health food store because they have to have an active license to buy it most times. The interesting part of that was that some of them still didn't move lab work.
Or when somebody complains about, oh my God, you've got me taking 20 or 30 pills a day. I said, yeah, well, the old stuff would take 80 or 100 a day, so get over it, because we're that much more advanced in what we're giving, in the quality and the efficacy and the absorbability. And yeah, I go to a lot of these seminars. I don't know about the one you're asking about, Rick, if it's a chiropractic thing. It's like, why have I never heard of it? I've been in practice since 1982. And here's one thing you can be aware of in any supplement. You'll see it on TV a lot. It's physician approved. Okay, you paid a guy $1,000 to say, yep, it's got my seal of approval. There's a lot of approval. They'll lead you into things. Be careful. And I don't know anything about what you're talking about. I'm not saying good or bad, but
and the thing with what we sell here, it's not just one brand of something. It's actually different brands that we have found over time that did the best on lab, and we have our Green Wisdom Health label on them.
And we do have some influence about how they're made, too.
Right, they're formulated for us, but it's not all from the same companies. And so, therefore, we've handpicked things that we knew made a difference on lab work. And I think a lot of the places that maybe you're going to, the physician's office, chiropractor's office, they're not doing the detailed lab work or don't know how to read the lab work, don't know what product, I guess, would make a lab value move, where Dr. Lewis has focused on that area of expertise more by taking many seminars about functional medicine.
Yeah, some of the things that you may not want to even get into is, do they use Albion or Trax minerals, or they use the cheap minerals like magnesium oxide or phosphate or calcium carbonate? You've heard me say that over the years. If you've taken calcium carbonate, you might as well go to West Texas and lick a rock for the calcium you're going to get out of it. Is the fish oil, is it an ethyl ester or re-esterified triglyceride? Our stuff is, it depends on the research. I've always said 293% better. There's different research, and I read some the other day. It said no, it's 393% better, more absorbed in the EPA, and 62%, I think, on the DHA. And then other research says something similar, but switched between the EPA and DHA. Do the vitamins or the USP? Are the amino acids? Are they chelated to an amino acid? I mean, there's so many things. There is lots and lots and lots of smoke, mirrors, hype, and baloney going out there.
And there's some good products, too. I mean, there are
yes.
some good ones mixed in with some bad ones, and that's the problem, is you don't really know the difference unless For us, we see it on lab, and we've had people come in here and go, "Oh, our stuff's wonderful," and we tried, and then we do lab, and it didn't do anything to the lab, so we would not carry it.
Well, and for those of you that stuck with us for years, which is many of you, like Rob up in Michigan, hey, call me, I miss you. Anyway, he's done it for 5-6 years. You've seen us go through a transition. Well, we've changed this formula to this formula, and I was going to read research that I saw about cat's claw being good for the immune system. One of the best things you can do is called GI Immune. It's got the Arabinogalactan, which I'm a big fan of, but it's got the AC11 cat's claw, which has an way increased absorbability. So GI Immune's one of the smartest thing you can do. But
and for us, I guess there are a lot of products out there that do work. The issue is based on what you get for the price. That's another factor for us. It's like we want to make sure that our patients are able to more readily afford something and stay with it longer than it be so expensive they can't stay with it very long.
So many of you, it's like, well, if you have to take 2 a day, well, used to you had to take 4. Mm-hmm. And many of our products have gone from 60 capsules to 100, and the price has not gone up. So we do shop price, but we'll never compromise in quality. So I don't know about that one, but, follow your heart. There's all sorts of scripture about loyalty and how God rewards you for that. So go home with the one that took you to the rodeo. That's a southern western thing.
Look at the results on lab is what I tell you.
Janet's shaking her head, and she's from Fort Worth. She's not a Cowtown girl. She's a fake Cowtown girl. Go home with the one that brought you to the rodeo is what I tell you.
Well, and we always tell somebody, do the products we tell you for 3 months, retest your lab, and I can bet you about 90% of it's going to be different when you run it again.
Well, that, and if you have a positive outcome, a positive outlook. And I called a lady up in Missouri yesterday, and she hadn't been on our stuff long, and she has some holy Jesus horrible problems. And I said, how are you doing? She says, this is better, 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 but I got exposed to COVID, and now I'm feeling horrible. I said, well, let's do everything we can to boost your immune system to allow your body to get better. But, here's a lady that suffered immensely, like in biblical proportions, and she still has a sweet spirit. So she's already noticed, but she expected good things. So your expectations, your faith counts for a lot.
So thank you for that question, Rick. Connie also had a question with having issues with swelling in her hand and fingers, mostly her index finger. She has pain in her feet and ankles when she wakes up. She thinks she needs something for joint pain issues. She would like to know what supplement you would recommend.
Boy, that's a tough one because it could be 100 different things, and it may be something you need to see your MD about too. You may have the beginning of autoimmune, something like rheumatoid. Now, when my joints ache, since we've been moving and I've been working like a 30-year-old that I think I am, my joints have been aching. Of course, I've been drinking more to relieve the stress. Now, to me, a lot is 2 drinks. Okay, folks, let's keep it in perspective. I've never been an idiot about such things, but my joints started aching, so I increased the detoxification stuff. The GI Immune's working real well. Janet gives me God only knows what in the drink, but there's plenty of things you can take. I would start with the multi-element buffered C. Our Joint Max is super, oh my God, incredible. I've got young men that really are in their 30s that do hard work in construction and maintenance that say when they run out of our turmeric complex, in 3 days they can't hardly function, and they take it again, and in another 3 days they feel totally 100%. And that's because the turmeric is very anti-inflammatory, but you've got to realize most of your turmeric curcumin only has 1% absorption. With the ones we've got, I've got several different companies competing for our business, and I said, yeah, great, give me the research. I told one guy that yesterday. We can get up to around 60 to 80% absorption.
That's awesome.
Rather than 1%.
So maybe that will help you, Connie, with your swelling. So
just call me, Connie.
Also, we wanted to discuss a little bit about how stress can interfere with your immune system, and God knows a lot of us are out there under it, and every month it's like playing Jumanji here to see what's going to happen next this year, which creates a whole new thing of stress. So that is really, really bad about lowering your immune system. So we would always tell you to take something that helps with stress. What would you recommend for stress, Dr. Lewis?
I don't know. I don't have any. We do listen to people that mentally and spiritually bring us up, but I take Easy Relax. I take 5-HTP. I take the Target GBX. Janet gave me a couple of, big dog probiotics because, our stress of moving.
Stress response was really good.
Yeah. That's a piece of God.
I think the other thing, because the other part of this is that the thing that sets it apart with coronavirus type symptoms is if you've got, a lot of people have been telling us they have a loss of taste or smell that's immediate,
which is linked to zinc or lack of.
Yeah, but I think that's one of the differences between that one and the flu is that they're telling us all that they've instantly lost their taste of smell.
Yeah.
And also that they have body aches all over and they're having a hard time breathing. So we just tell you to keep a little arsenal of things on hand, and when you start feeling like you're coming down with something, we're not curing any of this, but we could get your immune system up enough that maybe it would just make it go away the same way it came on because your immune system was down, right?
Yeah, and there's, it's probably about time to close. Is that right, Janet? Okay, I'd like to leave you with this. Let's not talk about disease. Let's talk about the causes of wellness just for a minute. You have to express a positive, creative spirit, which is love, truth, compassion, peace, integrity, and courage. You've heard that from me a lot. You have to have healthy, loving relationships. That's incredibly important. Thank you, Janet. Whole food diet and supplements. Moving the body, regular physical exercise like walking to the dock and throwing the fish food out. Adequate rest. So, yeah, we've got stuff for that, even though I rest pretty good, but I take a lot of stuff too. And then one of the most important is living with a clear, benevolent purpose and gift it to others, uplift others. And the more you uplift others, the more God blesses you back and increases the blessings that are bestowed upon you.
So hopefully you have learned something today. I hope we haven't rambled in so many different directions you had no clue what we said, but we hope you get that your immune system needs to be up.
I like to ramble though. You can put the pieces together.
I know.
It's a game.
And we hope that you have enough products on hand to get you through whatever's coming your way, and we are here to help you. If you need that information, please call us, email us. We'll be happy to give you the list of supplements we're recommending at greenwisdomhealth.com. Send it to Doc at greenwisdomhealth.com if you want to email him, and he can help you through anything that you have going on. If you're new to our show, do lab work so that we can see why your immune system is so low. Fill out our health survey at Green Wisdom Health, and we'll be here next week with another exciting show. You guys have a very blessed week.
Once again, our show has come to an end, but your hope in your health is only beginning. If you or a loved one are in need of a different outcome and are waiting for a brighter future, take the first step and go to our website and fill out the health survey. Please don't keep us a secret. If you know someone that could benefit from this podcast, please share this show with your friends and family. You are only one step away from a life worth living.